Welcome to Down the Dopamine Hole. I'm Amy Guertin. This is part two of Weird Symptoms of ADHD. If you missed part one, I suggest that you go back and watch it or listen to it. Not only did I talk about weird symptoms of ADHD, but I also talked about neurodivergence and executive functioning, so there's some good information there. Before I get into even more weird symptoms of ADHD, there's a couple things that I want to talk about. One is I hear a lot of people that say, how do I get evaluated if I think I have ADHD? That's actually pretty simple. Go to a psychiatrist. And I say go to a psychiatrist rather than go to your primary care physician, because just like any other medical issue, if you have a specific problem, you go to a specialist. And the specialist for mental health issues is a psychiatrist. Just like you're not going to expect your primary care physician to treat your cancer or your liver disease or whatever, don't expect your primary care physician to treat mental health issues. I hear a lot of people that are like, well, I've been like this forever and I've done just fine. Well, you know what? There's a big difference between fine and good. And part of the problem is because ADHD is a developmental disorder, which means you really have been like that forever, is people don't have an understanding of what it's like to feel any differently than the way that you feel. And you think, well, I have been like this forever. I have been fine. I mean, functioned up until now. Then you don't have an understanding of what it feels like to feel so much better. And I tell people, then why not try? Why not try to get treatment? And if you don't feel any different, don't do it. But if you do feel different, then do it. And people say, oh, but I don't want to be on medication. And I'm like, yeah, you know what? Neither do type 1 diabetics. Neither do people that have heart disease or high blood pressure or any of the hundreds of illnesses that people have that cause them to have to be on medication. But the thing that we have to realize is mental illness is medical illness. It is physical illness. If it wasn't, it wouldn't respond to medication. It's not really mental. Those are the symptoms that we often see, but that's not the cause, because if the cause was mental, medication wouldn't work. I'm going to show you a video of a woman who she's ADHD and she started on stimulants about a month before this video. And she told her husband that she didn't think that she was going to pick up her refill because she didn't really think that it was doing anything for her. And her husband basically said, are you kidding? Do you not notice the difference? And she really didn't. I'm going to put a link for the full video below if you want to watch it, but it's really important in order to see the difference between someone who is unmedicated and someone who is medicated in just a day.
Come brush your teeth. You're right. Come brush your teeth and wash your face. Come brush your teeth and wash your face. That's what did it. Yeah, yeah, he did it by himself. He said the baby. Yeah, yeah, he got himself. Are you proud of yourself? Myself? Are you proud of yourself? Good. I'm proud of you. You got yourself dressed all by yourself this morning. You're a big kid, man.
I will say this, if you get diagnosed by a psychiatrist, and even if you get medicated, you also need to see a therapist. A lot of people are under the impression that psychiatrists do therapy. They don't. That's not their specialty. That's not what they're designed to do. They're designed to do medication management. Therapists are designed to do therapy. And the reason why you also need a therapist is because you need to gain skills in how to deal with ADHD. The ADHD procrastination, the ADHD time blindness, the organizational issues, the working memory issues, all of those things need coping skills in order to deal with them. Medication is going to help, but there is no medication for any illness that is a cure. In general, most illnesses that you think about, you need medication, but then you also need lifestyle changes. Those lifestyle changes need to be learned. And that's where therapy comes in. Therapists who are familiar with ADHD are going to be the ones who are actually going to teach you how to do that. And they're going to teach you how to deal with a lot of the self esteem issues that come with ADHD because of the struggle that you've been dealing with your entire life. They will help you do things like be able to explain the symptoms that you have and why you do things to other people, like significant others or family members. There's a lot of things that you're going to gain in therapy that medication alone is just not going to do for you. Let's get into those weird symptoms of ADHD. You become a pro at masking. Masking is hiding your symptoms so you appear completely, or as completely as possible, normal to everyone else. This is due to trying to avoid the shame and stigma of ADHD. Example, many ADHD people have auditory processing problems. We don't completely process things that we hear because we can have delayed processing of what is said. We cannot take in auditory information as well as we do other methods like reading. We can even miss sounds in words, so we may not hear the word correctly. This can lead many people to think that ADHD people, especially kids, have hearing issues, which they don't. We can learn to ask people to send us directions that they gave us auditorily in a follow up email. We learn to take notes on everything. We buy those neat little recorders and we record everything, and then we have them transcribed into written notes. Those are different ways that we mask. Those are different ways that we figure out how to live in a neurotypical world. Masking tends to lead to more mental health issues like depression and anxiety. But interestingly, masking also leads to fight or flight responses. It leads to an increase in the production of cortisol, which is a stress hormone, and it also leads to more burnout. Okay, perfectionism. Perfectionism is an attempt to overcompensate for ADHD symptoms like missing details or losing things. It's a way to make up for perceived faults and failures. And it's a way to protect against rejection. Last time I talked about rejection sensitivity dysphoria, where we are extra sensitive to rejection. So it's kind of that, well, if I can do things perfectly, then maybe I won't be rejected. Picky eaters. Most of this has to do with sensory issues. We don't like the way that food feels. We don't like the texture of it, or we don't like the way that it looks. We don't like something about the food itself outside of just the taste. But there are people that are ADHD that are just picky eaters because they tend to be extra sensitive to tastes. Sugar craving. Sugar increases dopamine, which is something that people with ADHD have a deficiency of. So this tends to be another potential addiction. We know that people with ADHD tend to be more susceptible to addiction, and this is one of the addictions that ADHD people have. Tight muscles. Those with ADHD are really prone to tight muscles, pain, and have lower flexibility than people without ADHD. This may be at least partly due to motor regulation problems. This has to do with problems understanding where the body is in space. Also, balance. That has to do with sensory issues. I'm going to talk about in more detail in just a little bit. It also leads to what's called posture sway. And basically, they're these little back and forth movements that we tend to do either when sitting or when standing. And it helps us to maintain our balance. Another weird ADHD symptom is we tend to sit in weird positions. One is cross legged. There's a lot of ADHD people that sit cross legged. There's also something that's called W sitting. These positions tend to give us more stability when we're sitting. And this is the reason why we do that. And again, a lot of that has to do with understanding where our body is in space and our sense of balance. There's a lot of ADHD chairs, which are fabulous. There's a couple of different types. One are cross-legged chairs where they're wider so we can actually sit cross-legged comfortably in our chairs. And the other are ADHD chairs, which allows us to fidget, but it also allows us to sit in all of our weird positions. Boredom intolerance. Yes, nobody likes to be bored. Like, I don't know anybody that says, oh, I really like to be bored. But there's a difference between not liking boredom and being intolerant of boredom. And ADHD people are intolerant of boredom. And this is where a lot of our impulsivity comes from. When we are bored, we try to find something to do. And if we can't, we tend to start to get very impulsive because we tend to become more sensation seeking. Stimming. Stimming is repetitive behaviors that we do to get stimulation. And it can be when we're bored, it can be when we're upset, it can be when we're really happy. It can be talking to ourselves, humming, whistling, just making little vocal noises repeatedly. Hand flapping is a very common one. Rocking is a very common one. But any type of repetitive anything is considered stimming. And it's very common in ADHD people. Not only does stimming provide us with stimulation that helps us to self regulate, but it also can help us focus. Justice sensitivity, a strong sense of outrage at perceived injustices or unfairness. It can lead to really intrusive thoughts because we keep thinking about the thing that happened that we perceive as being unfair. It can cause people to get aggressive because they have a really hard time letting unfair situations go. It can also lead to an inability to lie or really extreme guilt if we do lie. And a lot of naivete. We tend to look at the world as it should be rather than as it actually is. We tend to have a constant internal monologue. Talking to yourself out loud is common, but even if you're not talking to yourself out loud, talking to yourself internally constantly is super common. It is a form of stimming, but it's also a way to help us process information. If we're doing something or if we're trying to figure out a problem, it helps us to process that information as we're doing it. But it's also a way to help us stay on task. So if you're doing something like, say, you're cooking and you turn away from what you're cooking to go get something like you're going to get a spoon, as you're walking to the drawer to get a spoon, you might be telling yourself in your head, get a spoon, 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 because you know that the chances of you getting distracted from what you're doing is really high. Problems prioritizing tasks. What motivates people without ADHD is priority. If something is a priority, they tend to do that first. That is not how it works with ADHD. What tends to motivate us is interest. If it's not interesting, we have a problem prioritizing it. Very often, if we make a list of to dos, we don't necessarily put that in order of priority. We just make a list. And then we will tend to do those in order of interest, or sometimes in order of ease, or in order of what we can get done the most quickly. So we don't tend to prioritize things. Taking out the trash can kind of carry the same weight as that 15-page paper that we have to get done. It has to do with executive functioning problems because executive functioning is everything that is needed to make a goal and carry out that goal. It can make it difficult for us to prioritize things that are involved in reaching our goal. Risk-taking behavior, it has to do with the impulsivity and the stimulation-seeking behavior, which is very common throughout a lot of our symptoms. Risk-taking behavior also can include oversharing. We have a tendency to overshare with people that we don't know. That can be very risky if you think about it. Forgetfulness. We have very poor working memories. We forget appointments. We forget things at home when you leave. Is there anyone else other than me that has to, not all the time, but that there's times when you have to walk, like you get out to your car and then you have to go back inside because you forgot something. And then you get back out to your car and then you have to go back inside because you forgot something else. That's very annoying. You forget things from your to-do list. You lose things. You just all of those things that you forget on a fairly daily basis. Pacing. When we are on the phone, when we are thinking about something, when we're upset, you have to remember that movement increases dopamine. When we are doing something where we're trying to think, we're trying to problem solve, we're trying to self-regulate, dopamine is going to help us to deal with those things. Sensory processing disorder. This is where we get into what I said I would get into in a minute. Sensory processing disorder. One of the things that people have to understand is we actually have 8 senses. We have the 5 that most of us know, which I always forget when I try to go through them. So let's see. We have sight, sound, touch, taste, and smell. Look at me, I did them all. But we also have 3 more that a lot of people aren't familiar with. One is our proprioceptive sense. And our proprioceptive sense is all of the signals that we get from our joints, our muscles, and our tendons. Well, there's 2 things. every time that our muscles, joints, and tendons are compressed or expanded. So this is pretty much anything that we do from walking to writing, because when we write, we're getting signals back as to how hard we're writing. This also tells us where our body is in space, not only where our body is in comparison to like the floor, if we're doing tumbling or if we're hanging upside down on a jungle gym, but it also tells us where our body is in comparison to other people. So if we're playing a team sport. One of the other senses is called our vestibular sense, and our vestibular sense is our sense of balance. Not only does it allow us to walk, but it allows us to bend over to pick something up off the floor without falling. It allows us to spin around and then be able to catch our balance so we don't fall down, things like that. And then the other one I talked about in my last video, which is called interoception. And interoception is all of the signals that we get from our body about what is going on internally, things like hunger, thirst, body temperature, tiredness, all of the things that let us know whether our body is in homeostasis or whether our body is in balance or not. What can happen with sensory processing disorder is we can be understimulated or overstimulated to any of those senses, generally multiple of those senses. You can get people that their vestibular sense is so overstimulated, they don't even want to get picked up because it messes with their sense of balance. But then you can get other kids that can spin and spin and spin, and then they fall down, and then they get up and they laugh and they keep doing it. Or you can get people that are very, very overstimulated to light, something that most people don't know. Fluorescent lights flicker at 100 times per second. There's people that can actually see that. So if you can imagine trying to sit in a classroom and learn in essentially what is a rave. And then there's people that are so undersensitive to light that they have difficulties seeing things unless it is very, very bright. A lot of people will have problems with things like the tags in their clothes and the seams in their socks, and lights might be too bright or sounds might be too loud. And so what can happen is the brain can actually process these things like they're threats, and they can go into a fight or flight response. Obviously, if kids are in a situation where they can't flee, then they can get aggressive, when it's not the fact that they're actually aggressive kids, it's the fact that their brain is processing things as a threat. Another symptom is doom piles. Doom stands for don't organize, only move. And it's basically piles of things that need to be gone through and organized, but they're so overwhelming that we have a tendency to put them off, and then we just move them from place to place to place. A lot of people have a preference for small silverware. Sometimes people have a preference for large silverware. But in general, people have a preference for one or the other. And a lot of times it's small, just because small silverware feels better. We tend to use similar stories that have happened to us to show empathy when people are telling us that something bothers them. It is not us trying to make it about ourselves. It is called associative thinking. And it is when we connect ideas, which people with ADHD tend to be able to do really quickly. We hear a story and it triggers a related memory, and we share it in an attempt to show proof of understanding. We find it easier to complete tasks if we do body doubling, which is having somebody else present or talking to somebody else while we are actually doing a task. That person does not have to help us do the task. The person just has to be present in some way. If they're physically present, they can just sit there and talk to us. We could talk to them on the phone. There's a couple of reasons for this. One is we have an external accountability that helps us maintain our focus. The social aspect of having someone there to talk to also helps to provide us with dopamine. And dopamine tends to help us to not have to continually motivate ourselves to complete a task. Food jags, eating the same things for multiple days in a row, often multiple times a day, before moving on to something else. It's just something that we do. And a lot of it has to do with the comfort of familiarity. Not being affected by or being calmed by caffeine. You have to keep in mind, caffeine is a stimulant. The treatment for ADHD is stimulants. The thing is, though, is that caffeine is never going to get to the level of stimulant medication. And that's why most of us are not going to be affected by caffeine. We can drink caffeine up until the moment we go to sleep. It's not going to affect us. Sometimes people can be calmed by caffeine, and this is only if people are going to be like slamming some serious energy drinks. And that is going to be because that level of caffeine is going to have a slight effect on the brains of people with ADHD, and it is going to calm them down. Not nearly as much as a stimulant would, but it may calm them down somewhat. All right, T-Rex hands or claw hands. This is when your hands are curled up by your chest or under your chin when you're sleeping. People tend to sleep like this, or if you're like me and you sleep with one hand under your pillow, you're going to have one hand under the pillow like this, but you're going to sleep like this. And I've had people that are like, I don't do that. And I'm like, okay. I'm like, cool. Like, I tend to take my cover like this and do this. And as soon as I told one of my friends that, he was like, "Oh, I do that." And I'm like, "Yeah, we do have a tendency to do that." And there's a couple reasons for this. One is it gives us proprioceptive input. So remember when I talked about having your joints and muscles and tendons compressed? That's what this does. Okay. By doing this and sleeping like this, it's compressing everything from here and up. The other reason is it actually protects your vital organs. It makes us feel safe. So not being able to be productive at any point prior to something that you have planned later in the day. This is a huge issue with ADHD people. And one of the major reasons for this is because it's task switching. You know that you have this task to do later in the day. And you know that if you do anything really productive or get into anything, you're going to have to stop. And then you're going to have to switch tasks to do whatever it is this thing is that you have to do later in the day. And that's going to be really difficult for you. So people have a very hard time doing anything productive if they know that they have something going on later in the day. Forgetting words. Forgetting words has to do with ADHD brain fog. It has to do with our racing thoughts. It has to do with task switching. Having that word right on the tip of your tongue and not being able to come up with it. It's very, very annoying. By the way, medication helps with that a lot. Having a high likelihood of having a learning disability. 50% of people with ADHD have learning disabilities. ADHD itself is not a learning disability. The most common are dyslexia, dyspraxia, and dyscalculia. Dyslexia is problems with reading. Dyspraxia tends to be problems with fine motor skills and gross motor skills, which I talked last week about there being some clumsiness that can account for that. And dyscalculia is where you switch numbers around, which, if any of you have that, can make two-factor authorization not a fun time. Developing frequent crushes or developing feelings for people very quickly. And a lot of this has to do with the dopamine. When we get into new relationships, there is a huge amount of dopamine involved. When we get those crushes, when we get those feelings really quickly, it feels amazing because of the amount of dopamine that's involved. Another symptom is tics, which are uncontrollable repetitive movements. And a lot of this has to do with not just the fact that tics tend to be really common with ADHD, but Tourette's tends to be also common with ADHD. Watching movies and shows over and over, listening to the same music over and over, or reading the same books over and over. A lot of this has to do with the fact that doing that is very soothing because it's predictable. We like things that are predictable. This tends to happen when something is upsetting in our lives or when our anxiety tends to be a little bit higher. Over explaining our behavior. That's a big one. Over explaining has to do with not being believed as a child, not being heard, not being listened to, not having our needs met, or feeling unsafe growing up. As a result of that, we tend to over-explain. Occasionally stuttering when talking. It's not something that somebody else would notice, but it may be something that you notice. And it's due to our brain working faster than our speech works. I know with me, when it happens, it tends to happen when I'm really tired and when I'm really involved in something that I'm trying to talk about. With me, it happens when I'm teaching and I'm very tired. Racing thoughts. It's really interesting, especially with women, because women with ADHD can often get diagnosed with bipolar 2, which is a less severe form of bipolar. Because in bipolar 2, people have racing thoughts, they have periods of productivity, they have things that we tend to see in ADHD. The problem is that in bipolar 2, these things happen in episodes. Well, yes, in ADHD, we can have periods of productivity because that's what happens once we get to that urgency stage. We get a whole bunch of stuff done in a really short period of time. But here's the difference with racing thoughts. Racing thoughts in bipolar 2 happen in episodes. There's periods of racing thoughts, and then there's periods where thoughts are not racing. In ADHD, racing thoughts happen all of the time. And that's one of the differences. So if you have been diagnosed with bipolar 2, there's a couple of things you need to look at, and you need to look at those hypomanic symptoms, and you need to see if those hypomanic symptoms are happening episodically or if they're happening more continually. And if they are happening more continually, you may need to talk to your doctor about ADHD as opposed to hypomania. We have kind of an ability to compartmentalize different aspects of our life and our emotions. We have the ability to kind of turn off or not think about certain aspects of our life if we are in other aspects of our life. If we are at work, maybe we have the ability to kind of just shut off everything that's going on at home, or vice versa. Work tends to be a little bit harder to shut off than home, but compartmentalizing is something that a lot of people with ADHD have a pretty good ability to do. Picking up minor changes in other people's behavior, and this often leads to a very good ability to read other people and situations. In general, if we meet somebody and we're just like, nope, we are very rarely wrong. This has to do with hyperobservance. This has to do with pattern recognition. And we have an ability to pick up on inconsistencies. If somebody's facial expressions aren't matching body language, or if facial expressions or body language aren't matching voice tone, or if voice tone isn't matching the words that somebody is saying, any type of inconsistencies, we're very good at picking up on that. Which leads me to the next thing, which is pattern recognition, which I did talk about in the last video when I talked about neurodivergence. But we everybody has something, some area in which their pattern recognition is very good. If you haven't figured yours out yet, sit down and think about it and ask the people around you, because they'll probably be able to give you a very good clue. Tossing is where we get rid of a lot of things rather than actually going through them and figuring out what to do with them, because going through things becomes very overwhelming. And unfortunately, what can happen is that tossing can start feeling really good. Like, oh, look at all this stuff I got rid of. And then we just start doing a lot of that. And sometimes we get rid of things that we probably shouldn't. So be aware. Being told that you are too much, too sensitive, too moody, too fill in the blank. And my suggestion to that is, if somebody tells you that you are too anything, go tell them to find less. There you go. Being good in a crisis, you got to understand something. Crises trigger adrenaline, and adrenaline provides stimulation. And stimulation tends to be really calming and really focusing for those with ADHD. So when there is a crisis, we are so calm. We are so able to think. We are so focused. Our problem solving abilities are so good. Like, when there's a crisis, you want us there. But guess what happens when, like, we lose our favorite pen, or we lose our phone and we can't find it, or we can't find our keys when we're trying to leave the house? We are a mess. We will lose it. But crisis, fabulous. Where's my favorite pen? I'm going to lose it. We work very well alone. We really need autonomy. And a lot of people with ADHD will start their own business because we don't do well with micromanaging, because we know that we need to do things in our own way. If we're micromanaged and told how to do something, it's not going to work well. We have to figure out our own ways of doing things. We have to figure out how we can be successful. We have very high levels of creativity. And this has to do with the fact that we have very divergent thinking. We think outside of the box. We have to, because we've had to learn to do things outside of the box. We also have very high levels of curiosity. This is an extremely prevalent trait throughout people with ADHD. We have the ability to put ideas together in new ways. And this is why there's high levels of creativity throughout the ADHD community. That's all I have for today. Thank you for spending your valuable time with me. I do really appreciate that. All of the research for this podcast can be found below and on the corresponding website, downthedopaminehole.com. If you liked what you saw, or if you think that what you saw or listened to can help another person, please share this with them. If you think that it can help your family, your friends, your loved ones understand you better, please share it with them. Also, feel free to comment because I love hearing what people are thinking while they are consuming any of these podcasts. I hope you learned something new, and I hope you enjoyed spending time with me. Be safe, take care of yourself, be happy, but most importantly, keep it weird.